Interesting facts about insomnia.
Insomnia is a sleeping disorder characterized by persistent difficulty falling asleep or staying asleep despite the opportunity. It is typically followed by functional impairment while awake. Insomniacs have been known to complain about being unable to close their eyes or rest their mind for more than a few minutes at a time. Both organic and non-organic insomnia constitute a sleep disorder. According to the U.S. Department of Health and Human Services, approximately 60 million Americans suffer from insomnia each year. Insomnia tends to increase with age and affects about 40% of women and 30% of men. Transient insomnia lasts from days to weeks. It can be caused by another disorder, by changes in the sleep environment, by the timing of sleep, or by stress. Its consequences, sleepiness and impaired psychomotor performance, are similar to those of sleep deprivation. If this form of insomnia continues to occur from time to time, the insomnia is classified as intermittent. Acute insomnia is the inability to consistently sleep well for a period of between 3 weeks to 6 months. Chronic insomnia lasts from months to years. It can be caused by another disorder, or it can be a primary disorder. Its effects can vary according to its causes. They might include sleepiness, muscular fatigue, and/or mental fatigue, but people with chronic insomnia often show increased alertness. Insomnia can be caused by psychoactive drugs or stimulants, including certain medication, herbs, caffeine, cocaine, ephedrine, amphetamines, methylphenidate, MDMA, methamphetamine and modafinil. Insomnia can be caused by hormone shifts such as those that precede menstruation and those during menopause. Psychological problems like fear, stress, anxiety, emotional or mental tension, work problems, financial stress, unsatisfactory sex life. Mental disorders such as clinical depression, bipolar disorder, general anxiety disorder. Disturbances of the circadian rhythm, such as shift work and jet lag, can cause an inability to sleep at some times of the day and excessive sleepiness at other times of the day. Jet lag is seen in people who travel through multiple time zones, as the time relative to the rising and setting of the sun no longer coincides with the body's internal concept of it. The insomnia experienced by shift workers is also a circadian rhythm sleep disorder. Certain neurological disorders, brain lesions, or history of traumatic brain injury. Medical conditions such as hyperthyroidism and Wilson's syndrome, abuse of over-the-counter or prescription sleep aids can produce rebound insomnia and poor sleep hygiene. Parasomnia, which includes a number of disruptive sleep events including nightmares, sleepwalking, violent behavior while sleeping, and REM behavior disorder, in which a person moves his/her physical body in response to events within his/her dreams. A rare genetic condition can cause a prion-based, permanent and eventually fatal form of insomnia called fatal familial insomnia. A common misconception is that the amount of sleep a person requires decreases as he or she ages. The ability to sleep for long periods, rather than the need for sleep, appears to be lost as people get older. Some elderly insomniacs toss and turn in bed and occasionally fall off the bed at night, diminishing the amount of sleep they receive. An overactive mind or physical pain may also be causes. Finding the underlying cause of insomnia is usually necessary to cure it. Insomnia can be common after the loss of a loved one, even years or decades after the death, if they have not gone through the grieving process. Insomnia commonly happens with anxiety, and the link can go both ways. You might find it tough to fall asleep when you can't soothe persistent feelings of worry and fear, for one. But chronic insomnia can leave you anxious about all the sleep you're not getting, not to mention make it more difficult to manage difficult and unwanted emotions during the day. When you don't get the sleep you need, your brain doesn't have the chance it needs to carry out important functions that keep it running smoothly. That's part of why you feel foggy and have trouble focusing when you get poor sleep. Insomnia isn't just a nuisance or small inconvenience. It's a sleep disorder that can affect mental and emotional health along with physical well-being. Thank you for watching. Please like and subscribe.